Today, basically, I was asked to speak about training load and how do we use it, and there's quite a few. It's got a lot of popular. There's a lot of popular debate about, and we've kind of it's risen very quickly, and I think we need to slow down a bit. And I'm just going to speak a bit about our working load, other people's working load, and where we think it sits. So I'm going to start with this. Have we got sound? Hopefully. No, we don't. We don't. I can't play it till we get sound. No sound? Okay, try again. Right, we'll try again and see. Nah, we've got no sound. Do you know the song War? What is it good for? It's basically that. And the idea was to say, load, what is it good for? That's quite disappointing. I've got a video coming up later, so it would be good to fix the sound for that as well, please. So what is it good for? Nothing, something, anything at all. Plan, I'm just going to go through a very slight introduction. Then I'm going to speak a little bit about training load and injury, which is what it is most famous for. And then speak a bit more about what I think it probably should be used for. Just wanted to bring this one up first of all as well. It was a nice article in Nature recently just saying it's only thanks to error detectors that we can proclaim that science is self-correcting. And I'm pretty sure if you don't know the face, you'll know the name Franco Impellizzeri. So we work a lot with Franco. He's a good friend. And he's come back into the sports science world and basically noticed quite a lot of errors or things that we can do better. So I think we should be grateful for people highlighting errors. And Franco's given me permission to use some work that he's doing currently and also some slides that he's used before. So monitoring training load. It's commonplace in elite sports teams, probably even in athletes, athletics, single sports as well. Commonly used football, AFL, NFL, the NBA, lots of different teams. But although it seems to be taken on as if it's something new, it's actually been around for a long time. And Franco and Aaron Coates and Samuele published this 15 years ago to introduce the concepts of internal and external load. But it also existed before that as well. So this isn't something that's new, although if we look at Twitter too much, it seems it's just arrived. It's commonly reported to assess or control or predict injury risk, and that's through various surveys we've done in professional football, international level football. It seems to be the consensus that this training load is important to assess the injury risk of the players. There's also a lot of research, so we're doing a systematic review just now with Franco, and we've identified 70 articles already, or based on this criteria, over 70 articles. We don't have the results yet, but that's coming. So it seems good for evidence-based practice because we're using experience and what we're thinking is good evidence. Now, if you hold up your phones to the screen, so we'll see if this one works. If you hold the phones up to the screen, it'll just pop up, click on the thingy, and it'll take you to a website, and we're going to try and do an online poll. So hopefully this works. Yeah. No, so it'll work on your phone. I'm just wondering if it'll work here. So I'll just wait till a few of the phones go down, and then I'll go to the next slide. Everyone got it? Yeah, so I'll go on. Let's see. It's looking good so far. No, come on. How do I press the play in the bottom corner? This one?
Do you need to allow?
You're killing me. Okay, that looks good. Yeah, this is disappointing.
So we're going to go on that website?
Yeah, it should come up with a play there, so you can just play it. It worked earlier. Yeah, there we go. There we go. Go to the play. Hey. Okay, so if you answer the question, it will start popping up with the answer. So, what is the most accurate statement regarding training load and injury? So based on the evidence that we know, what is the most accurate? Is it that training too much training load too soon increases injury risk? Too little increases, too much increases, not too much, not too little, but just enough? All of the above or none of the above? Pretty much everyone voted? Let's see. Oh, guys. No. What did you press there to bring up the answer, please?
Actually over here.
So now it should pop up with the right answer. Okay, so it's none of the above. You done better than a football team that I presented that recently, because they said none of the above. So actually, I'm going to show you now, when we look at the literature, none of those are the most accurate statement as to the influence of training load with injury. Thanks, guys. So now it should go back to the presentation. Yeah. So this is a study that's in revision at the moment, hopefully the last revision. It's been in for a while. Very complicated to look at. I'm going to simplify it, but essentially the numbers across the top are the acute chronic ratio. The grey bit in the middle is the sweet spot, so where the injury risk is at its lowest. The numbers in the boxes correspond to either to the injury risk, so a relative risk or odds ratio, depending on what the study looked at. If it's bold, it was significant. If it's got an asterisk, then there was also a very likely or likely magnitude-based inference. And then reference is just what they compared to when they calculated the injury risk. These are the studies only on football, on soccer, and for RPE, session RPE. This is the GPS metrics. So the exact same thing, acute chronic ratio, sweet spot, and where there's injury risks and protective factors have been found. And this is an example of basically what it shows. So we found all of these associations with injury risk. These have been reported in the literature. So a low chronic load decreases the injury risk, but then also a high chronic load decreases the injury risk as well. A high acute chronic ratio increases the risk. A high acute chronic ratio decreases the risk. Then studies have started to combine low and high with other things, and it's a low chronic load with a high acute chronic workload ratio increases the risk. High chronic load with high acute chronic decreases the risk. High chronic with high acute increases the risk also. But then also low chronic with a high acute chronic, can't even say the word now, has got no effect on risk. So basically it's a mess. The literature we have is a big mess, and there's a reason for it. We're working on something just now which is going to be quite big. I can't speak too much about it, but essentially we're looking to see if this is just a scientific, statistical artifact with these findings. So we can't say too much because we don't know yet. But there's a lot of problems. So what we do, I remember writing a paper for one of the UEFA papers, and I was trying to write the introduction, and I was finding it really difficult to summarize the literature and the introduction to say this is what we know, this is what we don't know, because it was so confusing like before. So I thought, okay, I'm going to go to we're supposed to trust consensus statements because it's the experts in the world that are bringing this together. Sometimes it's endorsed by, for this one, International Olympic Committee. So we're supposed to be able to go to this and trust what is said and have confidence, because as practitioners, maybe we don't have the skills to analyse the risk of bias in a paper, to check the methodological quality. So we need to be able to trust not only them, but the researchers who are doing the research in the first place that's included in this. So the main takeaways from this, and it helped me write the introduction, which was great. Special consideration should be given to the monitoring of acute and chronic loads and the acute-chronic ratio. Then we were said, okay, it's been validated in a model in 3 different sports. But actually, when we look at the research, when we break down the actual results, we want it to be true because it sounds good. Do too much too soon, it increases the risk of injury, of course. It's confirmation bias. But actually, when we look at the literature, that's not true because we don't actually know. We shouldn't give any consideration to injury. We can use it, and I'll explain why I think we can use it, but to assess the injury risk, it's quite dangerous. The model was never validated, so it's in a consensus to say it's actually a validated model when it's not validated. So with Franco, we wrote a letter of retraction or request of retraction or errata because it's not correct. We recently wrote a paper in Football Medicine Performance. This is a magazine in the UK for football, and they asked us to write to practitioners because the message is getting a bit out of control. And we called it, "It's time to stop chasing the training load unicorn," because we're trying to chase this magical unicorn because it's good, it's easy, it's great. I remember the first time I led a program, 2006 maybe, and I was flying to Australia. I was moving to Australia, and I spoke to Aaron Coots. And at the time, it was acute load was the magic number, and it was don't train over 2,500 units of RPE. And I said to Aaron, so I shouldn't go over that? And he was trying to explain to me that no, he can't tell you, there is no magic number, and I couldn't understand it at the time. I was like, no, but what is the number? So I've went through it myself, and I think, and now I'm on the other side where I'm actually realising what Aaron was saying to me 14 years ago.
The Clippers versus the Bulls. No Kawhi Leonard tonight. You know why he's not playing. Say it with me. He's out with load management. And it's not just Kawhi, also Patrick Beverly and Lou Will. Maybe the Los Angeles Clippers should just be the Los Angeles load management. Look at those dance moves from Paul George as he gets inside the Bulls. They're going to try to take advantage of all this load management cheese going on tonight.
He could have probably played, but I kept him out. And from that day on, I wanted to make sure that he was going to be healthy, so whenever I could, I gave him some rest. If that's load management, so be it. Load management today is kind of farcical to some degree.
That's the San Antonio Spurs NBA coach.
Take that for data.
Regrets about the way you handled your injury at the end of that stretch too, because that was all wrapped up together.
Yeah,
So now we're seeing
maybe watching Kawhi,
take
take his time and watching players take their time. Then, we think we're Superman. So at 25, it's like this crew is going to catch me if if I'm hurt. So I decided, you know what? This is really not that important, so I just kept, working out like I normally did.
Do you wish load management had existed when you were in the league? Because I asked Richard that yesterday, and we asked Tracy Brady that, and Max said he wishes it was more of a thing. He thinks his career would have extended.
Same thing. I think as athletes, we play hurt to prove we're actually hurt, instead of just getting healthy and going out to perform. And so, I wish that contract and money wasn't important to team and ticket sales. So it's like we're planning for the future, not just hurry up and get out there. You don't look that hurt. 60% of you is better than 100% of somebody like Richard. I hear people lie.
To late in the season, we've clinched and we can't get any better or any worse. And it could benefit from that. But I mean, why wouldn't I play if I'm healthy? It doesn't make any sense to me personally. I mean, I don't know how many games I got left in my career. I don't know how many kids that may show up to a game that they're to come see me play, and if I sit out, then what? That's my obligation. My obligation is to play for my teammates, and if I'm healthy, then I'm gonna play. If coach sits me out, then I'm not healthy, and it's just that simple.
I'm just curious
Last
with
one.
these guys, and I understand the load management there. I don't know if load management will creep into the NFL. Could you see a scenario where guys were taking games off?
Hint, it already has. So it's in the NFL. So it's what was quite obvious is that all of the hype around this, and we've oversold something that's not true. We've said we can predict injuries, we can control injuries, and then the messages that we're given are obviously getting to the coaches and to key people, and they're like, well, this doesn't make sense. Why would you take me out? And the idea is it's not to take you out of a game. It's not necessarily. One, I was speaking to Johan Bilsborough and the Patriots, and he said he had trouble getting a guy to buy into it, and they said, but the coach won't change anything anyway. I said, yeah, but it's not, maybe we don't change what the coach does, but we can change the stuff around it to make sure you're able to train and you're your best for the matches to get the buy-in. So the whole way that load has been sold through the scientific community, through research, and then through practitioners who've taken that on, believing it because we want to believe it's true, because it's convenient, and we maybe don't have the skills to understand the flaws in the research. So I think the biggest thing is that we need to not jump on things and maybe let's try to understand them. So yeah, it's not as any surprise that it's got this bad rep. When we look here, we've got the words and people have seen a lot in physio and medical kind of literature recently about language with patients, and it's the same thing here. We've got high training workloads alone don't cause sports injuries, and I think Rasmus Nielsen might be in here. I'm not sure if he is here. I saw him earlier, but what he's done is actually looking at causal research rather than what we've done, which is not the same. So yeah, that's it's how you get there. That's the real issue. Can predict. It's the important metric. Rapid spikes are the problem. It's not the destination. It's the workload journey that matters. This sells. It makes us want to read a journal. So it sells, but it's more like it seems more like a magazine, newspaper headlines. So in our article, we explain a bit about this and about the message from researchers to practitioners, from practitioners to coaches to players. We need to be very careful. I'm not going to go into this in detail, but does anyone know much about bias? What happens if you've got bias? What happens if you've got biases in your research? What does it mean? When you see a conclusion, should you trust the conclusion? At least we should acknowledge the biases, and if we're publishing something, we should try to minimize, and if we can't change it, we need to understand if it's going to affect the paper too much or the results too much, but we need to be open. So that's the definition in this paper that I found. Bias in research can occur either intentionally or unintentionally, causes false conclusions, potentially misleading, therefore it is immoral and unethical to conduct biased research. Every scientist should be aware, so should practitioners, and undertake all actions to minimize deviations from the truth. So I think that's where we are at the moment with workload and injury. And this is also relatively new to me in the last years. And does anybody take a guess at how many sources of bias there are, potential sources of bias? Doesn't mean it's in every paper or in everything, but can anybody have a guess? 10, 20, more than 20? 200? Well, in this paper, 75. They identified 75. And I don't know if maybe there are others, but yeah. And it's impossible for us to know. I speak English, my first language is English, and I don't understand most of this. So we need to study, but we need to be aware that they exist and try to teach people how to identify them. So yeah, bias everywhere. Just a quick example, which has gone off topic a wee bit, but it's exercise-based preventative strategies. So with Maurizio Fanchini, who's speaking tomorrow, we've done through the FC Barcelona muscle injury guide, and now we're publishing the paper. We wanted to understand, can we use exercise? What's the level of evidence to use exercises to prevent muscle injury in professional footballers? So because there's a lot of studies coming out, again, do Nordic hamstring exercise, you reduce injuries by 50%. When you're working with athletes or with teams, that's not true. So it's misleading, again, for me, and I think it puts too much pressure on us. So when we looked at professional football specifically and looked at exercise-based strategies, there's studies, but there was only one really that was at low risk of bias, which is Joa Haroy recently with a adductor. All the rest, there's a lot of bias. The level 3 studies were actually so flawed that they're not usable. You can't even use them. It's better just to throw them out. It's not surprising, I don't think. I'm going to show a slide that I've shown a few times, but I think it's quite nice to see the message. So if you've seen it before, I apologise. But I'm sure you've all seen this from Natalia Bittencourt, Complex Injury Systems. And I saw, I think she was Norwegian, picked up an ACL at the weekend, and no doubt on Twitter we'll have people saying, oh, we know why this happened, it's because of load or because of one thing. But when Natalia's looking at this, we've got to understand it's very complex, it's dynamic, multifactorial. We replicated kind of theoretical, based on the survey practitioners. We built a web based on their perceptions. So that's a level 5 web of determinants. And then we're working on it just now with Arsenal and with Natalia Bittencourt, Evert Verhagen in Amsterdam. We're working on actually using real data to start to understand this a bit better. And this is based on the perceptions. So we just built sort of a web of determinants ourselves. And these were all the risk factors, potential risk factors. Solid line means there's a strong interaction. We've not done the direction of interaction. The weaker the line, the less the interaction. So yeah, just subjective. That's all it is. But it just keeps going and going and going, keeps going. And then there was other. So as well as all of that, there was other ones that we hadn't considered. And that's the two. So we're looking at, if we are talking about load, it's only 2 small parts of the overall picture when we're looking at injury. So it doesn't make sense for load to be used to assess injury risk. So take home messages from section 1, and then I've just got a short bit of section 2, because it's not, so I don't want to go away and think, oh, it's all doom and gloom, can't do anything. So training load shouldn't be used to assess injury risk, never mind predict injury. The acute chronic ratio cannot give any practical recommendations over that of common sense, but you don't need an acute chronic ratio to make a common sense judgment. Need to be careful with the messages as a researcher to practitioners, as practitioners to the coach and to the players. And we need, I think this one's important, you need to study, you need to take it upon yourself to start to study methodological issues in papers and biases so that you can identify them quickly. The centre, Oxford-based Evidence Medicine Centre, CEBM, if you put that in Google, they've got really, really simple critical appraisal tools for different study types. That's probably a good place to start. But I think this is very, very important because it changes the way you read research. So why do we monitor training load then? What is it good for? Now, I don't know if anyone's seen this theoretical framework, again from Franco Impeliceri, who's basically kind of trying to show, okay, like, let's calm down, this is how we should do it. And this is probably where load fits into the overall training process. So we're not using it for injury, but we're using it in a process to try and affect training and get outcomes. So we've got our first step, which is performance. So here in this example, it's injury. So it might be that you want to improve repeated sprint ability, you want to improve something else, but you have to have a performance outcome that you want. So it could be injury. You then need to understand what are the determinants, what are the limiting factors to that. So if we're talking about injury, maybe it's the load applied to a structure and the ability of the structure to cope with that load. So this is in preparation, again, with Franco. So I think we're going to have some really good stuff coming out soon. So we need to understand that to then define the training goals. Then we've got a target. It's okay, what do we do now? And then this is where load can start to come in. So we can define, okay, what exercise will improve this based on the evidence, based on my experience. This is these are the exercises that I think will bring about an adaptation in X, in your performance. And for that, you're looking at organization. So how do you structure the program, the quality, and the quantity. And then that defines what is the external load. So that is basically going to be what's applied to the athlete or the patient or the player. Based on that, then you have your internal load. So you have a response. And at the moment, it seems to be, I don't know in other sports, but certainly in football, in our football, a lot of the training is based on external load. So people just implement GPS. Let's run 500 meters. Let's run 1,000. Like we need to cover 20 kilometers. But if we all go out and do 10 times 100 meters, we're all going to experience it very differently. So the external load is just simply something that a player or a person is doing. It doesn't say how they've coped with it or what their response to it is, sorry. Is it actually going to have a response that's going to change something that's a limiting factor? Very individual, obviously, and it can change according to certain factors. Then we test the training outcomes to see if anything changed, and then we can look back and see if we met our training goals or not. So that's probably for me and for Franco and for Merete who's here, and he's going to speak about it in the workshop with examples tomorrow. That's probably where load fits in. It fits into the training process. And within that, that's not necessarily to say, red flag, he's going to get injured. Because chances are, they probably aren't. Even if we've had acute chronic ratio is 4.4 and nothing happens. Okay, so this is how I think. And then we just simplified it in the article in the Football Medicine and Performance magazine. We simplified the model there, so we go through the cycles. At the top, we have planning. And if we've got a goal without a plan, it's just a wish. So we need to have that plan, very important. Implementation, and then also here for controlling. So we're trying to control, has what has been done, what has been planned, has it been done or not? And should we make recommendations to modify something in the training plan? I put this one in because it's just a nice, I think it's good to look at other areas and not just look at our own. That's why I think we've made a lot of mistakes in sports science, medicine research on the load ratio, because we've not included epidemiologists and proper statisticians inside the studies. Does anybody know how many basic training principles there are? How much have I got?
Not a lot.
Yes, I'm just done.
Okay.
Just done in a minute. Does anybody know how many training principles there are? 1, 2, 3. Does anybody guess? Well, guess. Sorry. Does anybody know what they are? You speak English? Yeah. So this is basically, this will take you back to probably first year degree level. But I think these things are getting forgotten now, and people are forgetting about this and focusing on technology, GPS, and getting a bit carried away. So basically, I'll just wrap it up there. That's essentially what I believe and colleagues believe that we should use load for, to control if the athlete has done what was planned, and then to control how they're tolerating that planned load. All good?
Thank you very much.
Thank you.
I think we will keep questions for the end so we can hopefully have a good panel discussion about some of these hot topics going on and get some different perspectives on them and have a good discussion. So if you hold all your burning questions for Alan, that would be great. So maybe we want to monitor training load for different reasons, maybe to monitor how our training is going and how we're adapting and responding to that. Our next speaker is Stephen West. Stephen has been working for the past number of years in a professional rugby setting in the UK. So he's been working, coordinating, collecting both load monitoring and injury surveillance data within Premiership Rugby. So today he's going to be talking about what are the different ways we can actually monitor load and what can we do with the data when we get it. So I'll leave it to you, Stephen.
Thank you very much, Sinead. So firstly, let me just say a big thank you to everybody that's here today and to the organising committee for inviting me to speak. So as Sinead has said, I've been asked to kind of cover what's the best way to monitor training load. And I always like to start by just saying that load is a word which kind of gets thrown around quite a lot across sports science and sports medicine disciplines. And And when we think about load, it's not just the training you do, it's not just the matches you play, but it's also the psychological and the social effects that it potentially has. And this kind of changes between whether you're looking at recreational level athletes or community athletes, down to kids, and all the way through to professional athletes. So we need to think about that. So what I'm going to be focusing on specifically, and what we're talking about here, is the physical loads, okay? So they're your match and training loads, and I suppose this quotation kind of sums it up quite nicely. So that's the cumulative amount of load placed on an individual from multiple training sessions and games over a period of time. Okay, so just to give yourself a reminder that this isn't just physical load, this is all aspects of load, and it's just part of the puzzle. And I think to answer the question, what's the best way to monitor load, we need to think about the overall cycle of monitoring an athlete. And one of the bits which kind of gets overlooked a little bit is to make sure that we have a question in mind before we start monitoring load. So don't just say, oh, well, you know, someone else is doing it, so I better do it too. You actually have to have a question in mind to make sure that you're selecting the correct tools to be able to answer that question. So once you have a question, you can then, as I say, select a tool, go ahead and capture the data that you need, find some way of pulling all of that information together and aggregating it so that you can then go and analyze it, followed by interpreting that data, considering lots of contextual factors and other bits and bobs which I'll talk about, and finally then feeding that information back to the coach or the athlete who's asked for that in the first place. So all important steps, and I'll touch on each of them. So the first section is kind of to talk about how to select a tool and what tools to select. So Alan's kind of gone through this already, so I don't really need to talk too much about this. But essentially, after we've decided exactly what we're looking to achieve from our training, and we decide how our training is going to be made up in terms of organisation, quality, and quantity, we get, as Alan has already kind of described, what is external load. Okay, so for me, I think the best way to think of this is the work that's been completed by the athlete. So that could be a distance, that could be a power output, that could be something like that. And as he mentioned, you know, everybody in this room could experience the same external load, but the internal load will be different for each person, okay? So that is the relative physiological and psychological stress imposed on that athlete. And that's made up by lots of different characteristics. So not only could that be different between two different athletes, but also the same athlete on a different day when they may have slept better the night before, or they may have slept worse, or the weather's better, or the type of pitch they're playing on. So lots of considerations there. Again, I won't go through all of this, but essentially you then get your adaptation, your training outcomes, and that builds back into the start of the cycle. So I think that's all been covered off. But the main two things that I want you to take from this slide is that there's two different types of load. You've got your external load and you've got your internal load. So your external load is common across all athletes, or your group of athletes that you give it to, but it elicits a different response in each athlete, and that's what is known as your internal load, okay? And that's what determines the functional outcome of your training. So it's really important to try and capture both if you can, but that's not always possible in every setting, especially where resources are limited. So certainly from my perspective, I would always go to the internal load above the external load. So really good paper this. This was a consensus statement outlining, you know, all the different measures of load that you could possibly use, and I'm sure you probably can't see it, especially down the back, but the important thing is that there's a huge number of measures available. So you've got all of your internal load potential options up here, external load options here, and I'm sure there's more. And I won't go through this, but if it is something you're considering and you have a question in mind and you want to collect load, it's definitely worth having a read of this paper just so you can see what the kind of validity and reliability of some of these tools is currently in the literature. So once we've kind of decided that we're going to monitor load, there's a couple of other considerations that I think are really important when deciding which one to choose. So this was something that we wanted to do in the context of my PhD. We wanted to find out what measures were being used by rugby clubs in the English Premiership. So we got a group. We had 13 clubs over the course of 2 seasons, and we asked them what are the measurements that you use, and how much do you actually value them in managing injury risk. So across the x-axis here, you've got a whole host of different measures that were used across clubs. And then along the y-axis, you've got a scale kind of between 1 and 5 saying 5 is a really important measure that we think is really important for injury risk, and 1 is a measure that we don't really value at all. So these were experienced practitioners working with professional athletes on a day-to-day basis, and what you can see is that nearly every measure that was mentioned was either highly valued by one club and not at all valued by another. So there's clearly a lot of kind of individual practitioner preference. So the first thing that you need to think about is either whether it be you or the practitioners that are going to be using this information, what do you actually enjoy using? What do you think is going to be useful? So it just kind of gives you an idea that not one thing is best for everybody. The next thing then is around cost and availability. So as I've kind of already mentioned, one of the nice things with monitoring load is there's something for everyone. So if you're on a limited resources budget, there's plenty of both internal and external measures that you can use. So things like session RP, it requires a paper, pen, and the time to be able to go and ask an athlete how the session was. So very simple, very easy, good for kind of the low resource kind of environment. And then obviously as we go up towards professional end of sport, we've got similarly lots of options for both internal and external load that you can select what you need based on what you want to use. So that's the next consideration. The next thing we need to think about is time and expertise. So not only do you have the time to collect the data, analyze it, produce reports and feedback to the coach, but also do you have the people around you that are actually able to interpret that data and make positive and good decisions based off it, okay? The next thing that you might want to think about is monitoring regularity. So not only from the perspective of how often will you have time to ask or to collect this data from your athletes, but also we don't want to burden them with a huge number of measures that we're collecting. We don't want to turn them into robots by basically collecting every single thing they do. So we need to think about that. So again, another quite nice kind of table to summarize this. So you've got obviously measures which need to be collected on a session by session basis, all the way up to information that can be collected on a monthly basis or even at different time points during the season. So the next thing is obviously thinking about the sport that you're involved with. So thinking about the sport, what are the demands of the sport? Is it a sport which requires a lot of mental strain? Is there a lot of biomechanical factors at play? Is it a really high physiological demand? And off the back of that, you can start to think about what are the different types of things that we want to be collecting as a result of that. So I won't go through all of this, but essentially if this is something that you potentially want to start thinking about, a really good paper here to have a look at. And not only that, but thinking about the type of sport that you're dealing with. So if you're dealing with an open team-based sport, which is highly dynamic and it's externally paced by what's going on around you, well, then you might want to consider one type of monitoring tool. Whereas if you're in a sport which is internally paced or quite repetitive in what they're doing, then again, the same measure probably won't be applicable. So it's really important to think about the exact sport that you're dealing with. And again, just to highlight that there's both objective and subjective measures that you can use within that. So if you want more information, that's a really, really good paper and a good resource to have to look into some of those areas. And then again, so this isn't something that I've personally done a lot of work in myself, but to some degree, when we think about GPS heart rate, RPE, we're talking about kind of global load. But in some cases, we might actually want to look at a tissue-specific level. So this was a nice paper that came out a couple of weeks ago or even last week, just looking at from a biomechanical perspective. Obviously, we can look at both the whole body loads, but also the structural tissue level loads. But then we start to ask the question whether they're actually viable to do within the setting of the field or whether they have to be lab-based. So again, depending on the sport, tissue level specificity is something you might want to think about. It's not something, as I say, I've dealt with, but I think as wearables and so on get more and more common, it probably will go down that route. So just to kind of summarize all of that, I'm not going to go through it all again, but essentially the main thing to take out of it is you've got two different types of load, external load and internal load. One is the work that's done by the athlete. The other is the athlete's response to that work. Okay, so very important to distinguish between those two. When you're actually selecting a tool, making sure that you're taking into account all of those considerations, alongside lots of other considerations, but I think they're just some key ones. And then the last thing just from this particular section is to just say, it doesn't matter how well resourced your club or your environment is, there is always a measure available to you. So make sure that when you're thinking about the questions that you're asking and the questions you want to answer, that you're selecting the correct tool, because there will be something out there for you. So moving on to the next step of the athlete monitoring cycle, and we have data aggregation. So pulling all of that information together after we've captured it. So this came from a piece of work done by my PhD supervisor, Dr. Sean Williams at the University of Bath. And what he did was he did a principal component analysis looking at what the key kind of areas of training load or the key methods of pulling this information together were. And he came up with 3 kind of main areas. So the first was acute loads. So depending on what sport you're working in or what papers you read, you can kind of see anywhere from between 2 and 9 days as being an acute load. And often this is referred to as being your kind of fatigue kind of loading. And then you've got chronic loads, which can kind of, again, depending on the paper you're looking at, be anywhere from between 2 weeks to several months. So those are the kind of 2 main ones, and that kind of potentially is said to represent more of a fitness kind of element. The third type then is changes in load. So Alan's already kind of spoken about the acute chronic workload ratio, and I'll touch on that in a second, but there are other ones, so training monotony, training strain, things like week-to-week changes and differential load. So there's lots of different available options, and I'll quickly touch on some of those now. So I won't go too much into this because I think Alan's covered it quite nicely, but I think a lot of people think that the acute chronic workload ratio stems from research in injury, but actually where it comes from is is performance-based. So when we see some of those findings associated with injury risk and the inconsistency between them, is that potentially something to do with the fact that all the kind of early work in this was based on performance and not injury? Again, some of these things have been highlighted, some haven't, but in the last couple of years, this is kind of the angle that we've been looking at it from. There's been a lot of concerns over the way in which the acute chronic workload ratio has been calculated, and I won't go into them. I don't want to bore you all to death, but if anybody does have any questions about them, please come up and we can have a chat about it afterwards. But essentially the things to look at here are things like the calculation method. So are you using rolling or exponentially weighted averages? Things around mathematical coupling, selecting those acute and chronic timeframes to actually apply this over, and then, as Alan has kind of covered already, whether this sweet spot for injury risk actually exists. So we wanted to do this across our cohort. So over the course of 3 seasons, we collected training load and injury information from 13 clubs. We had about 2,000 injuries within the data set, and essentially what we did was we produced all of these possible ways that you could calculate training load or the acute chronic workload ratio, and we saw to see what was the most sensitive way to actually detect injury risk and whether that would be useful. So when we pooled all of that information together, we saw that combining all that information, we saw that a 3 to 14 day acute to chronic workload ratio was more important for rugby than, say, a 7 to 28 days, which is what's commonly used. When we looked at this on an individual club level, though, we saw that across 13 clubs, there was 7 or 8 different ways to actually analyze it. Okay, so there's huge variability, and that kind of calls into question, 1, is this something that clubs should be doing on a club-by-club basis? Or in fact, is this something that actually just isn't really very reproducible? And not only from a club basis, but if you were to do this at the level of the individual, if you were to do this at the level of the actual monitoring tool you're using, you'll probably find something different. So again, this kind of just gives you a representation of how much variability there is associated with this. So as I mentioned, there are alternatives to the acute chronic workload ratio. We don't have to use that. So some of those are training monotony, which is kind of a reflection of training variation. So as opposed to the acute chronic where it's tracking for big spikes, this is kind of telling you whether you're actually getting any adaptation because it's just the same thing over and over, and whether that's good for an athlete or not. We've got things like training strain, week-to-week change, so that can be monitored as an absolute measure from week to week in whatever metric that you're looking at, so high-speed running, total distance, session RP, or whatever, or it can be measured as a percentage change. The final one then is differential load, and this is something that we started looking at as part of my PhD, and again, my supervisors carried on some good work in this. So this is very similar to week change, but what we're doing with that one is that we're applying a kind of a smoothed rate of change, so that if there is a lot of daily variation, which there may be depending on match loads, it kind of accounts for that, so it doesn't fluctuate quite so much as week-to-week change itself. So just to kind of point out, there are other alternatives, and I haven't really touched on the difference between these kind of relative loads compared to absolute loads, which I think Merete is going to talk a little bit about. So important to think about those as well. So next kind of section of the athlete monitoring cycle is this idea of data analysis and interpretation, and there's two kind of ways to think about this, and I've divided into kind of what to think about as a practitioner working with athletes on a day-to-day basis, or from a research perspective and actually trying to analyze this longitudinal data. So from a practice perspective, I think it's really important that each athlete is going to be very individual, and they'll all have their own physiological, psychological, social, and multiple other different types of differences. So when it comes to then applying kind of injury prevention strategies, treatments, diet, recovery, psychological intervention, we can't just apply the same thing to everybody. We need to think about the individual, and we need to make sure that we're appropriately addressing that. And this quite nice paper came out and kind of showed some good ways to be able to do that. So one of the things they mentioned was the use of control charts. And this is an example that we had used previously in injury surveillance in professional rugby, whereby we were looking at essentially control charts are very simple to use. There's kind of a set of rules that we use to detect as early as possible trends in the data so that we can try and assess what the underlying factor is that's causing those trends. So this was just monthly injuries over the course of a season, but again, you could use this for performance or whatever other metrics that you're tracking. The other thing as well is to obviously somehow capture that individual variation, so with the likes of mixed modelling. So in this case, we use mixed modelling to assess professional or English rugby sevens players. We wanted to assess their heart rate variability response to a really high dose of external load, so high-speed running. And again, you might find that overall there's a negative effect, but what you can see is that there's quite a range of differences between individual athletes, and it was quite interesting talking to the coach who works with this team, because he probably was able to tell me who those high responders and low responders were before I even analysed this data, but this for him was a way that he could confirm his suspicions about certain players and then make changes based off that. So anybody in the blue, they responded in a positive sense to that stimulus, and the guys in red were the ones that responded negatively. So then in terms of for research, so if you're a researcher, you're looking to try and collect this long-term injury surveillance data and load data and actually do something with it. Again, I would direct you to this paper, a really nice paper by Johan Windt and his colleagues, looking at how to get the most out of that data. And what they did was they kind of reviewed some of the statistical methods that were being used to analyze this type of data. And this was kind of the summary table. I'd go away and have a look at this yourself in your own time, but some of the things, I thought these were quite interesting factors that needed to be considered. So pretty commonplace in training load data, so thinking about how to deal with missing and unbalanced data, the fact that you're using repeated measures, and then for me, probably the most important one is that injury is clearly a very multifactorial thing, and we need to think about some of those factors. So again, based off this information, we wanted to include this. So in our when we went to go and analyze that huge data set of training load and injury, we wanted to think about, right, what were the key elements outside of training load that we might want to consider. So based off our kind of searching of the literature, there were a couple of key things that we thought in rugby union that would be really important. So they were age, position, previous injury within the last 12 months, previous concussion within the last 12 months, and then the number of match minutes that they'd played in the last 12 months. So these came from other sources of good research and good evidence that have previously shown some kind of relationship. And what we wanted to make sure was that we weren't looking at training load in isolation. We were building upon these other factors when we were looking at injury risk. So what we saw was that age wasn't a significant predictor, neither was position. What we did see was, and unsurprisingly, within that 12-month period, as soon as an athlete had one previous injury, their risk of getting another injury jumped massively. So if you have a player who you know hasn't had an injury for the last 12 months, you want to keep that for as long as possible. And then obviously every subsequent injury they had after that then increased their risk further. Same thing happened with concussion. So as soon as a concussion occurred, there was a higher risk. It's previously been reported by one of my colleagues, Dr. McCall, that that's a 60% risk. We didn't quite see that when we had accounted for all those other risk factors, but it was still a significant increase. And then what we also saw was that our lower exposure players in terms of match minutes actually had the highest risk. So just some kind of preliminary findings. We're looking to publish this at the moment, so there's more to come on that. So kind of just to finish off, bringing you back to this and saying, just to remind you that, again, this is just a small part of the puzzle. I'm only talking about the physical loads. I haven't mentioned at all about any of the other things, especially in a professional cohort, that they might have to deal with. And the one big thing that I have as a question is monitoring load now becoming an extra load that we need to think about? Not only from the perspective of athletes and asking them to monitor the load, but also on the practitioners, having to go and produce reports and all that comes with it. So we need to start thinking now about how we're doing that. Finally then, going back to our kind of athlete monitoring cycle, and the last slide, just to kind of say, so in terms of tool selection and data capture, there's a tool for every environment. Make sure that you find the one that answers the questions you want and is suitable for the environment you're working in. In terms of data aggregation, there's loads of options out there, so make sure that you don't just go for the popular one, and understand the limitations of the measure you're using. In terms of interpretation and analysis, make sure you're accounting for individual responses and that you're using multifactorial modeling. And finally then, just making sure that, I didn't touch on this, but it's kind of obvious, if we're trying to feed this information back to coaches, make sure that it's relevant to them and that they understand what they're saying and it's not just a graph with lots of complicated stats or anything. So thank you very much to everybody that's been involved with the study, all of the Premiership Rugby clubs, England Rugby, England Sevens, and the great work and the great group at Bath University. So thank you very much.
Thank you, Stephen. Lots of valuable information taken there, and you can pick his brain on all the technical, nerdy stuff in one of the breaks, I think. So our next speaker is Merida Molar. Merida is in a joint position between Oslo Sports Trauma Research Centre and in the University of Southern Denmark. So our two previous speakers come very much from the high-performance professional sporting environment, but a lot of the athletes we work with are not necessarily in that context. So there's also a really high risk of injury in youth sports, and this is an area which Merida has been working very strongly in, and we don't always have the capacity to do these things in youth sports or in non-professional sports, so Merida's going to give us some perspectives on the youth sport context.
Yes. Thank you so much, Sinead, and thank you for the invitation. It's always a pleasure to be here in Denmark. And as you can hear, my English is Danish English, but I don't get the same question as you. So I'm going to talk about, as you said, I'm going to focus on the youth athletes today. And I'm always focused on the youth athletes because I think they deserve much more attention that they are giving now, both in the literature. And if you're also working with youth athletes, I want you to remember the target of that work. The target is about working with youth athletes is about the development of the healthy, capable, and resilient young athletes while attaining a widespread and enjoyable participation for all levels of participation, which was actually nicely stated in the IOC consensus from 2015. So this is This is a whole other group than the players that you were showing from the basketball, who have and should focus on the performance perspective. This is about development, health, and resilient young athletes while they're having fun, so they are able to perform when they are senior players. So I think that's a huge difference. But unfortunately, the reality is not always like that. And I'm going to give you an example. So this is Lisa. She's a young handball player. She moves away from home when she is 17 and starts at a special kind of school where she can train more than she can in her local club. When she is 18, she's very talented. So when she's 18, she starts to play both at the senior team and the youth team at her club. And when most of the other players are going on summer vacation, she is playing at the European Championship for the youth national team. So when she gets back, she actually starts to play at the full-time senior level, even though she's still a youth player. And then she starts to feel some of her knee pain. But she's very important for that club, and she continues to play matches, but she reduces her training load. And in the winter break, she gets her first knee surgery, and it's a small, minor surgery, so she's back within 4 to 6 weeks and starts playing again, but it's then still the focus on next match and reduces her training load. And then she attends the World Championship, actually as both as the youth and the senior at the same year. So lots of loads on different levels for this player. And she, again, gets a new injury. She recovers on and off, go on to performance, go on to practice. But at the age of 20, she gets her second new problem. She gets her second, her third, and her fourth knee surgery, and she ends her career. So I think this is a classic example of how bad decisions regarding load and injuries can affect the development of a young player. So she's not getting the potential to maximize as a senior. And perhaps you have some similar examples from your clinic. Is this something that you are familiar with? Yes, it's definitely something that I am familiar with because it's actually my own story. And the problem is, even though this is 20 years ago, it's still a story for many, many young handball players today. And I think we have a huge challenge here to do, and we really need to act on this, because fact is that we are losing many of our athletes before they are senior elite. So we need to do something about it. So the question then is, how do we manage this load and injury risk in youth? And it's a bit uncomfortable to talk about this after Alan's talk, but I will try to go through it as the best I can. Just to put it down very simply, on the one side we have capacity, and the other side we have the load that we apply to the youth athletes. And it is, of course, a balancing act between the player's capacity and the load that we apply to that athlete. Now, again, we have load is many things. We have training loads, and we have the non-sports loads. Can be the non-sports loads, can be the live events, stress, and the daily hassles. I'm not going to focus on that today. I think there will be a great session about that tomorrow. So I'm going to focus on the training load again. And training load, we mean training and competition. Okay? And then on the other side, there's a lot of factors influence the capacity. I've just given some of the examples. It can be strength, it can be recovery time, and of course diet and sleep and so forth. So the question then is, how much is too much training load for these youth athletes? And actually there is two recent systematic reviews looking into that. And you may be surprised to read the key points after you've heard Alan's talk. But nevertheless, one of the key points from this systematic review from 2019 was the association between the chronic workload ratio and non-contact injuries is supported by the literature. So that's one thing. The other thing is, in that review, there's no studies included on youth, and all studies are on males. Then there is a systematic review from 2018. Also, this included 49 papers, and this also had a key point. The relationship between training load and injury has become firmly established in the literature. Here, there is 7 studies in youth team sport. So, as you know, this is a topic that is really popular. So, just within in 2019, there's lots of more publications. So, I did an extra literature search and find 6 more studies on youth team sports, which I have included in this graph that I'm going to show you now. So, we have 13 prospective cohorts in youth athletes. They analyze training load in different ways. It can be the absolute load, it can be relative load, and it could be match congestion. And there is a study that found if you play many matches within the last 100 days, you increase the risk of injury. Well, it's a large period. Then there's 7 studies looking at the association between absolute load and injury risk. Here, 4 studies confirms that there is a relationship between the absolute load and injury risk. And I would like to highlight, I'm not going to go into detail, but this is actually a new, I think, interesting study, which is focusing on this absolute load thing. And then we have the relative load, as you know, it can be the acute chronic workload ratio, the week to week, and the strain and monotony. Now, just briefly, there's not approximately half of them say there's some kind of association between training load and injury risk in youth. However, as Alan said, there's absolutely no consistency in injury definition, how to define training load, and so forth. And another limitation I think it's important to highlight is the sample size of these studies. So most of these studies have a sample size below 100, then it's actually very hard to say anything about associations, I think, that we can use in a preventive way. And many of these studies are below 50, have a study population below 50. Again, 2 out of 13 studies have included something about female. So in short, again, there is very limited evidence to support the findings from senior team sports that they can be directly applied in a youth setting. And I think, unfortunately, practice today is that they are applying it, what they found in senior male sports into a youth setting. So that's what we know about training load and competition. But I also said that there is a balancing act between the capacity and training load variables. So the question actually is to get a better understanding of the etiology behind these injuries is to ask how do the capacity-related variables moderate the amount of training load a player can tolerate. And that's something that we have looked at in our handball study, where we had the primary outcome of any new shoulder problem in the dominant arm, and by handball load I mean the training and competition hours. And as you heard, there's many ways to calculate handball load. The way we did it was that we every week measured the hours of training and competition for these handball players. And after this 4 weeks of measurement, we took the average of these 4 weeks, and then we looked at the amount of training load in the week after that 4 weeks, and then we investigated if a sudden increase in training load was associated with an injury in the following week. Then we a priori defined 3 states, so that if if a player suddenly increased in the weekly handball playing load above or below 20% compared to the 4-week preceding average, or if they increase between 20 to 60% compared to the 4 weeks preceding average, and then above 60%. So we have 3 main categories. And we did this every week. We calculated this for every week. Now, as a moderating factor, we have an example where we included the shoulder external rotation strength, and we measured that in neutral and in 30 degrees internal rotation. And we defined reduced external rotation strength when they had a ratio, external-internal ratio below 0.75. So just to sum up our main findings, we actually found that as long as the player didn't increase the weekly handball playing load above 20%, they had a low increase of shoulder injury, no matter how weak they were in the external rotations. Good. The next thing we found is if the players increased their weekly handball playing load above 60%, it didn't matter how strong they were in the external rotators. Because of the high increase in handball playing load, they had an increased risk for shoulder injury. However, the interesting thing was that if the player had a reduced external rotational strength, then the player couldn't tolerate as much increase in the weekly handball playing load as compared to players with strong external rotators. So this indicates, with the limitations, of course, still in the study, that the training load is the primary factor in regards to development of shoulder injuries, and that the shoulder strength moderates the amount of training load a player can tolerate. So this means that we can intervene on 2 places. We can intervene on the load management, but we must remember that we also still can intervene on improving the function of the shoulder. So just to give an example, if, for instance, you have a player who hasn't have another injury and hasn't played for a long time, and they have a 4 weeks preceding average of 2 hours, well, then this player shouldn't, of course, increase that much in the following week in her weekly handball playing load, especially if she has reduced external rotational strength. However, if you manage to safely build up her chronic phase, well, then she is actually able to tolerate a much more higher increase in her weekly playing load. Okay. So the question then is, what about the other injury types? Because in handball we do have a lot of injuries. And some of the most prevalent injuries is injuries to the lower extremity, ankle and knee injuries. And we applied the same cut points as we did on the shoulder to these extremity injuries. And here, if we look at the whole group, we didn't find any associations. However, if we split that group up into 2, into boys and into girls, we didn't find any associations in the boys group. But if we look at the girls and look at the traumatic injuries, and here it was just lower extremity overall, it could be the traumatic knee injuries, and if we combine knee and ankle traumatic injuries, here we actually find that the girls had an increase, twice as high injury risk already with a low increase in handball playing load. So here it was all of them already had it here when they increased above 20%. So cut points for the weekly increase in training load may differ between boys and girls. It makes sense, I think. And cut points for the weekly increase in training load may differ between upper extremity and lower extremity. So this is an example of some of the structure-specific things that both Alan and Stephen talked about. Now I say may because there is still limitations in our studies as well. But nevertheless, I just wanted to say that our studies by far has the largest sample size. And I just want to say thank you here and acknowledge all the participants and players and physiotherapists. Some of you are here today for making that possible. Because I actually think that it has contributed to with something new sorts, at least. Okay, so how can we put this into practice? So it makes sense to reduce spikes. It makes sense that we need to build up the chronic phase. We just cannot say how much. We don't have the exactly cut point. And it's still important, not too much and not too little in 1 week. It's common sense. And you are experts on this. And when you rehab injuries, you just have to move this upstream and apply it also in primary prevention, I think. Because right now we do not have the literature to support any specific cut points. So how do we monitor load? Stephen have covered nicely, but I think it's important also in youth setting that there might be different concerns. So obviously it would be really nice to have GPS and be able to monitor the external load very closely, but it's rarely feasible in a youth setting. So then we must rely on self-reports, and it's been done as training diaries, it's time, it's session RPE, as Stephen said. But the question then is, when you ask youth players about their rating their intensity of the training, can we actually trust them? Can we actually rely on their rating? That's something that we are investigating now. But again, you have to think about what is relevant and feasible in your setting. I still want to think, so we have this training load, but it is also about the other factors. And we may not have so much literature about the training load, but we do actually have some quite a substantial literature about how we can increase capacity by improving strength and neuromuscular activity. And just by applying simple exercises, it has shown to reduce, to halve the injury risk in many sports. And if I'm not going to go into detail that will be a great session. I think Saturday morning about detailing that. But if you are interested in some inspiration for exercises that can reduce injuries in sport, I highly recommend this Norwegian webpage, and it is in English as well, Fit to Play. And it's also available as apps and the Get Set app. Okay, so with some extent, we do have some practical tools that can help us to develop healthy and capable and resilient athletes. And it's all good. It's all good in theory, but in practice, we mustn't forget that decisions regarding training load is highly influenced by the personal determinants and the environmental factors surrounding these athletes. For instance, a youth player can decide not to do the strength exercises because if she finds it boring, or she's so competitive that she continues to compete despite a high pain level. And that is, of course, not only rooted in her own experience and knowledge, it's certainly also influenced by the people surrounding her. It's the parents, it's the coaches, and the coaches' decisions regarding this is obviously also influenced by more on an organizational level. And I think it's important when we talk about training load management, it's not only about the physical factors, it's also about an intervention in the environment and the culture. We need to have focus on those. And then there is, I think, a very special challenge with the youth setting. Now, if you remember the example from before, we have a youth player and she plays in several arenas, and she's also perhaps playing other sports. It's really, really hard to monitor the load in all these settings, and it's certainly hard to manage it because it requires a huge communication between these settings, which is, I think, it's a huge challenge in practice. If you then compare that to a senior athlete, he has perhaps three settings. He has the club, the national, and he has his own training. I'm not saying that that they are not having much load as a senior players. I know they have, but they also have a much better possibility to manage that load than that we see in the youth setting. Because if we go back at this youth setting, we must not forget they may be youth athletes, but they are still children. If you think back when you were young and you were a teenager, how many good decisions were you able to make regarding future health and management? It was, I certainly could not, obviously, as you saw on the slide. So as a youth player, you really need adults. It's our responsibility to help these youth players cope with all this load that they are applied to. And who is the adult surrounding these youth adults? It may be different in your setting, but in handball, it's very often a volunteer coach. He has absolutely no idea what training load management is. He's coming to training after work, and he's planning his training in his car and that's reality also. Then we perhaps have a school teacher, and then we have the parents. And I put the parents in yellow because they can go both ways. I think sometimes, and they should be really supportive, sometimes they are the pushing ones. And we must remember that as well. And then we have the physio. And I'm not gonna, it can be any health service providers, I'm not being selective here. So my question is, how many of you are working with youth athletes in the clinic? Good. But how many of you are then working with youth athletes from a primary preventive perspective, before injury and not after injury? That's the first time I see so many hands, so that's really, really nice to see. Thank you so much. Because reality is often that physios or other health service providers in youth setting are involved later, much later in the process. And you are the ones who you're the one that are coming to this conference. So you know a lot about load management. These don't. But you, at the moment, are not involved in this. If you then compare again to the senior, he has lots. He has lots to people surrounding him, helping him making the right decisions about training load management. So I think if we think about the high risk these young players have when they are young athletes, I think it's fair to say our organization, at least in Denmark, does not match the reality and needs of our young athletes. And I strongly believe we should do something about it, and how we should do it and it should start today already. So my last question to you, and last thing I want you to think about is, how can you contribute to raising the awareness and knowledge and practical guidance and how is it said in English? Priorities regarding load and risk management in your youth setting? Because we cannot wait on the evidence. This is so important that we need the ones that actually know something about it, do it also as not only from a rehab perspective, but most certainly also in a primary preventive study perspective. Thank you.